most functional neurology circles, there's not an appreciation for the adjustment. The chiropractic adjustment can affect the brain. I got out of the hospital, they told me that, you're not going to do anything anymore. You're not going to be anything anymore. And I was just like, okay, pretty pissed. I mean, I had to do something. But I developed on my right side paralysis. You go through intensive, then, 3 weeks after you finish the intensive, you go about sitting on the couch eating bonbons and tortilla chips, and you go right back to where you were before. Welcome to My Pods Podcast. I'm Dr. Joe Schneider, and after 35 years as a functional neurologist, a personal journey through stroke recovery, and helping thousands of patients, I'm here to share breakthrough solutions for POTS and neurological wellness. From getting out of bed in the morning to rebuilding your nervous system, this is your guide to understanding and overcoming neurological challenges. Let's begin this journey to recovery together.
Freddie's telling me, man, you're knocking it out of the park, big guy. Congratulations.
Yeah, things are really busy. Yeah, really busy. Yeah, it's good.
For you.
It really is good. Yeah.
Good for you.
Thanks.
I heard you got,
it's rewarding.
End up getting,
it's really rewarding. So it's, yeah.
Well, that's all that matters, man. I heard you got a chair. Did you end up getting the NOTC chair?
Not yet. They keep saying it. They were supposed to get it to me last year. I was pretty excited.
Well, I remember, like in January, right?
Yeah.
You were all ready to rock and roll.
Rock and roll. Have you come out and the whole thing? I was ready to go, and I sent them all the money, and it just like nothing happened. So, but I think like they're getting their act together. We had the goggles. I've had the goggles before. I had the other system. It was called DX100. So I've been doing all my diagnostics on that. I wasn't doing much medical testing, so I kind of knew how to use the system. And then the new goggles came, and they're much better. So I was excited about that too. And so I got an old goggle, a new goggle, and I'm just doing my best with what I got. So, but I'll see you for the training in July.
Yeah, I think Freddie and I may come out and visit your office during that time period.
Yeah.
I think he mentioned something to me, I think 18th during that time period. Yeah, so I think I'll be up in Pittsburgh as well. We'll see. I'm still trying to figure out, we're still trying to work something out with pricing. It's been one of those long journeys.
It seems like they are a long journey company.
Jeez.
I'm very impatient there, Adam. I'm not a long journey type of person, right?
I don't blame you. And Freddie's keeps saying, if you just listen to us, I mean, a lot of this would have been solved a long time ago. But
a long time ago, exactly.
We don't own the company, so
yeah.
But I think things are coming around.
Yeah, pretty quickly. I'm pretty hopeful.
Yeah.
I say my prayers, and every day it's like, okay, bless Bryson. Bless Bryson.
So how do you want to do this, big guy? I mean, do you just want to ask questions, or I think know.
We want to talk, we've been doing this for so long that we want to talk. So it's called POTS Podcast, but it really is about functional neurology and the autonomic nervous system.
Okay.
And, I'm an old guy, and I got a lot of gray hair. It's getting grayer by the day.
Yeah, so am I, man. It's getting there. I still have hair, which is...
Yeah, so
I have good genes.
Before I got hooked up with my technology, right, I relied on my skills as a functional neurologist and my observation skills, and my adjusting skills to affect brain function, right?
Right.
And I'm pretty much the same today as I was way back when.
I got it.
I have a lot of technology in the office, and I think it assists me in doing it. But I always go back to looking at the peripheral autonomic nervous system and how working with that can affect the brain. And I'll tell you what, in most functional neurology circles, there's not an appreciation for the adjustment, the chiropractic adjustment, and how
I
that
got it.
can affect the brain. Like even like when we were talking before, it was about the visual system. Like let's get some research going where we actually can prove it that giving a good adjustment can start affecting maybe visual movement systems, which we're doing with.
Well, if you're interested in doing some research, we should talk about that when I come up. And it wouldn't be very hard to put some studies together. You have the patient load, and we could do some real simple studies showing eye
I
movements,
love
the
it.
adjustment.
I would love it.
Real simple. I mean,
Mm-hmm.
I'll write them up, and everything like that. I'll just need you to do the work and gather the data, and then you'll get published. I'll get published, and away we go.
Okay.
You
I'm
know,
all
it's
for it.
it's
I mean,
it's not very hard to do,
mm-hmm.
especially in this day and age with AI coming out these days. My God, you could just ask AI to write you a research article.
Yeah,
you know,
exactly. Yeah.
the way things are changing and everything like that. So yeah, let's talk about that and let's hammer out some ideas and then we'll just put it together and get published and go from there. All
Exactly.
right.
Yeah. But I think that the connectivity of our mechanoreceptors or muscle receptors, our fascial receptors, and everything has a profound effect on overall function.
Yes, I totally agree. You and I come from the same place.
Okay.
I mean, that was always my main tool was the adjustment as a foundation to everything else.
To everything
So
else, right?
yeah, everything was adjunctive to the adjustment and it helped just help facilitate. I mean, that's the way I kind of looked at it
Mm-hmm.
as to where it's our other colleagues have gone. They've given up on the adjustment and now they've made everything else the primary thing, I
Yeah,
think.
and like it should be that brain and body and brain are the connective issues that we're seeing with these patients, the patient population. So, chronic fatigue, like when they come in with POTS, they're really dysautonomic and
Yeah.
it's so vast in the combination of issues that they're having, right? Sensory issues, um, muscle spasm, dystonic areas, uh,
Yeah.
um, you know, pontomedullary reticular formation, I mean, those things that we've like tested for years, extensor stress
Right.
above T6, flexor below T6. I mean, it's like
Right.
on every day I use it 20 times. Cerebellar issues, you know what I mean? Cross, same side. Yeah.
Right.
So, if you do the test and then you follow up with the adjustment and then you retest, it's miraculous sometimes that what
No, I agree with you.
the simple aspects, right? So the brain body connection is really important as the overall master control system. And
Right.
your master control system is about input. It's about experiencing our environment.
Right.
So the questions that I have for you is you've done a lot of work on muscle system patterning, sensory patterning, sensory dysfunction, muscle dysfunction, right?
Right.
Those four, all right? So I like you to input about that too, because I think that's an important part of your study and an important part of your education.
Right. So, you know what, with that in mind, what I can tell you is that when I went through and I did my master's, we spent a lot of time on embryology and brain development. And one of the things that really stood out for me during that time period of learning all these things was that one of the very first systems to develop in utero, like when a baby's developing in the womb, is the proprioceptive and vestibular systems. They're like the very first ones to show up. And the proprioceptive system is all the nerve endings and connections that come from joints, from muscles, and all the ones that basically pick up movement.
Right. Mm-hmm.
And the very first ones out of those to develop are the ones that are within the spine. And they're kind of interesting because they provide the baseline stimulation that is needed for the rest of the brain to fully develop within the womb, in utero, and also as a child develops throughout the years. Like it takes what? I mean, I don't think people realize this, but it takes us 20 years to fully develop. I mean, we're one heck of a complex machine, right? The brain is so complex that it takes it 20 years to fully develop. And for guys, we're lucky if we even get there, right?
Yeah,
we're still in our 30s and 40s, and women are going, I don't think your brain's fully developed yet, but you get the idea. So
we're definitely
for
slower.
me,
We're definitely slower.
yeah, yeah. So for me, looking at movement, looking at posture and postural alignment, especially of the spine, becomes really important when it comes to brain activity, because any loss of these inputs over a lifetime or over a period of like critical development is going to hinder brain development. And that's where, like, for me, when I was going through the masters, having a chiropractic background, that's where the big lights came on for me as to the importance of, the spinal alignment, the importance of looking at what are called subluxations, or some people can call them fixations or malpositioned joints. They're all kind of saying the same thing, just something wrong in the spine where the joints don't move the way they're supposed to move.
Right.
And that can cause a significant hindrance onto the way our brains work. Now, the way that it hinders things is it just doesn't hinder one system. It can affect all these other systems because, from a developmental standpoint, those systems, that proprioceptive input, those joints, those muscles, provided the baseline activity for everything else to develop. Your eyesight, your hearing, your balance, I mean, how you think, how you regulate your heart rate, your sympathetic systems, autonomic systems, all those developed afterwards. So, it makes sense to say that, hey, if someone has an issue in their spine, it could show up in any one of these systems.
Oh, exactly.
And that's why I think, yeah, and I think that's why you probably notice in your own practice, you know, the input and impact that you can have on a person's life just by adjusting them, you know.
Exactly. But
You
also,
want
if you have an extremity that's cyanotic, right?
Yeah.
And then you go up to the thoracic spine and you're looking at sympathetic chain ganglion. So it doesn't just affect muscles and sensory fibers. You have sensory patterning, muscle patterning. But then you also have a autonomic patterning that happens at first level at the spinal level at the intermediate lateral cell nucleus, right?
Mm-hmm.
So, but it's also will go central to a brain pattern. So as you
Mm-hmm.
work your muscles, you're saying, I need energy for that muscle to contract. And
Absolutely.
the more I'm trying to contract it, the heavier the weight, the more speed that I have, that's going to cause a pattern of fuel so that we can do more work. And that
Yes.
and in an exercise system, right? If we're doing an exercise system or any activity, then the bottom line is the first thing that's necessary is fueling it.
Right.
Right?
And
Basic
on that
fuels
note,
are it's through blood flow, right? You don't
right.
get it there
And
unless
on
the
that
blood flows.
note, our system is wired so that every sensory stimulus that comes from movement, as you described, is going to activate fuel delivery or activate your sympathetic system to deliver fuel to the areas being moved, you
Yeah.
know,
Yeah.
and
Uh-huh.
that's an important part because the less movement you have, the less fuel delivery you have. So my idea would be this: if you have restrictions in the movement of your neck, you're not going to have as much fuel delivery to these muscles. And over time, they're going to become weaker. And then that creates other issues for you. It's in stabilizing your head. But the other part of it is that because everything stimulates your sympathetic system, you also need something to kind of calm it down. And that comes from your brain. So your brain is designed to kind of keep everything in check. So when you start to lose brain activity over as you get older, you lose the ability to regulate your sympathetic systems and they become a little bit out of control for you. That's why you see the high blood pressures, the dysautonomias that you see a lot in your office, I'm sure, especially in people who've had concussions, who've had, brain injuries. I mean, they usually have issues with, too much sympathetic activity. And the work that I think that we do through, adjusting and that helps to stimulate the brain to kind of calm these systems down again.
Right.
You know,
Exactly.
that's the yeah, that's the way that I look at it. So, it's always a balancing act, you know, between those things that, promote fuel delivery, which we want, but you don't want it to be too much. You need to have something to kind of keep it in check as well.
Yeah, and you have to remember we always talked about what is the metabolic capability of the system
Yeah,
to accept the amount of care that we want to give the system. Now,
right,
I know that intensives are big with like all the big top functional neurology centers, and
right.
they're not always appropriate.
I would agree.
Okay, and so I mean, I'm fighting that all the time because, a person will come to me and I'll examine them, I'll put them through the diagnostics, and I'm like, your system's got to take it slow. It's got to be a slow, progressive um, exercising of the different systems that are weak because your body cannot accept more than that. And then they'll say, well, I called so and so, and they want me to come out in a week, and they'll tell me a week I'll be 90%.
Yeah, that's got to be frustrating. And I would,
It's not. It's absolutely scary. It's
okay.
scary, right?
Oh, I was being a little nicer.
Well, I don't want to be nice about it anymore. You know what I mean? Like really, the reason I called you because I got absolutely disgusted with it. All right.
All right, I don't blame you. All right, okay. So the gloves are off. Good.
Patients are sacred. They really are. When you want accepting their trust, right?
Hmm.
Then you really need to understand the most simple concepts of them all, right? And put them together in a way in which we bring a patient forward that causes permanence
Yeah.
rather than temporary fix.
Right.
Okay. Um, and
And
then,
some people get so fixed on a model that they can't think outside of that model anymore. So, like you say, there's these people who do these intensives, and sometimes they are appropriate, but they won't consider when it's not appropriate, and they think it fits everybody. So they become the cookie cutter that they didn't want to become, right?
yeah,
Because they're just cookie cutting a treatment into this intensive, like everybody needs these intensives. So I agree with you 100%. I mean, that's a big problem. You're not the first person that has has brought it up, but I commend you for bringing it up and bringing it to the forefront of a discussion I think needs to happen just amongst ourselves as colleagues, you know?
yeah. Because I have an anesthesiologist who had a concussion
Hmm.
and he's been calling around and he's like, they told me that, in 1 week, that's what he says, right? And I'm like, Okay, I mean,
I
in a week you can clap your hands and go ahead.
I wish it worked that way,
Oh, I wish it did too sometimes. Yeah.
but in my experience, as probably as yours, it really doesn't. I mean, sure, they're going to get improvement if they will get improvement during that week, but what they don't tell you is a lot of these people have to come back, and they have to come back numerous times.
Numerous times, yes.
Yes,
Uh-huh.
so they'll pitch the idea that it's only going to take a week, but the reality is that they're coming back at least 3 or 4 different times. You
Yeah,
know,
well, isn't life like that?
it is absolutely.
You go through intensive, then, 3 weeks after you finish intensive, you go about sitting on the couch eating bonbons and tortilla chips, and you go right back to where you were
Right,
before. So, the system does need to be exercised on a continuous basis, and it it has to be done really well, like really well.
right, and taking into fact, like just like you said, their metabolic capacity, and it's pretty well been established that anyone who's had a concussion or who's had like any chronic neurological disorders or whatever that you want to call them, they're going to have metabolic issues. Their nerve cells just won't be able to keep up with the metabolic demand of doing their jobs. So then it questions, okay, well, do we go in there and do we stimulate these things, when they're already having difficulty keeping up just doing what they're doing? So do we create an environment first where we support that metabolic demand, and then we ease them into, okay, now we're going to do more stimulations, which I would assume that you're already doing with your patients.
Exactly, exactly. What I mean, but sometimes you need a friend to pat you on the back, right?
Well, I support you 100% in that.
So I'm really serious.
No, I really did, because I mean, the more I've read about it, the more I see the importance of it, and I think that every clinic should have a protocol where they're dealing with the metabolic issues
Mhm.
and the metabolic demand issues of their patients. It's just not about going in there and stimulating and thinking it's all going to work out.
It's all going to work out. Yeah.
Yeah,
It may work out for like 20 seconds and then all of a sudden it's all gone again.
yeah, they crash, or
Yeah.
they don't end up improving, and that's why they come to you, who acknowledges it and says, hey, you know what, you're probably not a good candidate for an intensive. We got to start you off slower here, and so on. So I remember hearing years ago, I mean, it's always best to do less than to do more when you get started. You
Yeah,
know,
definitely. Exactly.
yeah,
Yeah.
you kind of whatever, test the waters to
Mhm.
see what people can tolerate. I don't think you can do that in a short, like a 1 week period.
Yeah,
I think,
especially we get a lot of kids that have chronic fatigue with this dysautonomia. And it's a horrendous type of fatigue where they really can't get out of bed. And if they get out of bed for an hour, then they got to go back to bed, or they can't get to school, or they can't work, they can't do anything. So they're disabled by fatigue. And so,
so let me ask you, can you share some of the things that you do in your office to address those? Maybe just not in kids, but in just the general patient population. What kind of things have you established that you find
what
helpful?
we know, what we know from our patient base is that they have inflammatory disorders that are affecting the mitochondria.
Yeah.
So I always thought that mitophagy was like a good thing. Get rid of the bad mitochondria. But when you're continuously getting rid of bad mitochondria and you're not upset,
And you're not replacing them.
right? Not
Yeah.
replacing them, then a nerve just says, I'm really tired. And Adam, when I had my stroke, right? I got out of the hospital, they told me that, you're not gonna do anything anymore, you're not gonna be anything anymore. And I was just like, Okay, pretty pissed. You know, I mean, I had to do something. But I developed on my right side paralysis. I have some thalamic pain in
Okay.
my hand and my foot. You know, it's always affecting me. You know, I rub my arm all the time, my leg. But I get it when I walk, I get a floppy foot. So at first it's not floppy, but if I go like a half a mile, I can start feeling get floppy.
Right.
Like
Just
the
starts the
patients with
fatigue.
EDS, they talk about I have EDS. Everybody has that EDS now, whether they've been tested for it genetically or not. They all have it.
Mm-hmm.
And so I say, well, you got floppy foot syndrome. They're like, what's that mean? It's not just my foot, my low back, my neck, and everything. But as you get the brain functioning better, right, and the nerve tracts that have atrophied over time start coming back, right, and getting stronger again, then you can do more before the controls around the joint become unstable.
Yes, absolutely.
So by stroke on my left side, my right ankle is floppy. So I went to Dallas to look at some regenerative medicine things that we're starting to do in the office, and they lost my suitcase. So,
Okay.
I was kind of like for the day, I was got my maximum standing and walk rate, and then I tripled it by running all over the place trying to find my luggage before I went home. So I got like the severe ankle sprain, and it's
Okay.
been like 5 weeks, and it's still not where I want it to be. And so, that's my floppy foot story.
Right.
It has a broader meaning, because that since I lost the muscle controls in my basal ganglion and some of the sensory areas in my thalamus, that I have a limitation.
Yeah,
Body
absolutely.
has limitations, right? And so we know that the sicker we are, the more limit we have,
Mm-hmm.
right? So it can be metabolic, it can be muscular, it can be sensory. Okay, they're the three basics. Okay, and so that's what I struggle with from my history, and everybody does, right? And
Right.
but when these kids get really sick and they have chronic fatigue and they have less strength in their muscles and they have less controls around joint structures, right? Then they're all saying I've been diagnosed with EDS, right? And it's a genetic thing and there's nothing you can do about it. And I'm saying, okay, I know that if I strengthen the three structures, right, in our major operating system,
Mm-hmm.
that that can either go away or become much less.
Right.
Um, and
My,
manipulating the joint, right, or the structures around it really help. Now, the other thing that I always like from what we learned when in the beginnings about manipulation
right.
is that we affect 3 to 6 structures above and below.
Yep.
The interconnectivity of the spine is pretty vast. So you can have some hypermobile segments within those 3 to 6, right?
Mm-hmm.
And then you can have some hypomobile structures
Yep.
or dystonic muscles versus flaccid muscles. And that's what I'm finding a lot with these cases, that you don't want to keep adjusting a flaccid system, and you want to be able to activate the systems that have dystonic activity or too much activity.
Right. Right.
And it's getting fun. It's getting fun kind of knowing it and
Right.
applying it, right?
Right.
Um,
Yeah, there's
so the diagnosis is not important.
yeah, I agree with you. I mean, there's, we think that if we put a name on something, then that tells us how to fix it. And I'm not a big fan of that for the most part. Um, I think what you fix is what you see in front of you. You know, when it comes to neurological disorders, you know, people ask, well, how do you measure brain activity? I mean, how do you measure one's brain capacity and stuff like that? And one of the ways that you and I do it is we look at movement, just like you said. You know, you look at movement, you look at muscle tone, like you're talking about some segments being having more tone than other segments, you know, and you try to restore a balance in there by giving them adjustments and things along those lines. That there was a researcher, a PhD researcher out of the UK. Uh, his name's Daniel Wolpert, and he's a movement guy. So that's all he does. He studies human movement. And he gave a lecture on TED Talks about why we have brains. And his conclusion was the only reason we have a brain is to create meaningful, purposeful movements that affect our environment. I mean, I kind of thought about it and I go, "Why, it makes sense, right? I mean, everything that we do in our world is a result of movement. So, you know, you and I study that. We're kind of movement experts. Whether it's looking at eyes, looking at, you know, posturing and things along those lines. And it is fun when you start to, like you said, you know, you start to relate how these movement patterns relate to how the brain is working. And then how you change these movement patterns, you change people's brains. And it is almost analogous looking at someone who's depressed. I mean, most people who are depressed, to a non-depressed person looking at them, you could pretty well say, hey, what's wrong with you? You look depressed. Well, why do they look depressed? Movement, whether it's a facial expression, whether they're kind of like dopey and moving along and everything like that. So what's interesting for you and I would think that once we change that movement through adjusting and the other things that we do in a higher tech level, then all of a sudden we find that miraculously, oh, they're feeling better. They're not as depressed. You know, they didn't need a medication or something like that. We were able to find the pattern and change that brain activity, improve it, and then you can see a result in better movement and things along those lines. So I always thought that was fascinating. When I listened to that lecture, I was kind of like, all right, that makes a lot of sense now. And that's why I think that's in our profession. I think some of that is a little bit of a lost art, that people don't value it as much as I would think they should. And I think you probably would agree with that.
Yeah, exactly.
Yeah.
Yeah. Last point that I really want to cover is I'm
Mm-hmm.
finding that segmented care for this type of population that we're looking at doesn't do them justice. That you
What do you mean by that?
well, uh, we know the adjustment's a powerful means of affecting the peripheral and the central nervous system, and the peripheral and central autonomic nervous system also. So we want to, with our clients, take a broader look at their function because they have so many comorbidities, right? And um, and so we want to develop programs in which we do comprehensive therapeutics to kind of identify the strengthening of all the systems that we're finding that are weak. Like neurofeedback, laser therapy, exercise with oxygen. You know, we don't do hyperbarics. We do different exercise system for it, interactive metronome,
Mm-hmm.
cross crawl activities, whole body vibration.
Right.
Um, and if we do enough of all the stuff that we need to do, and we tailor it to each patient, we find we get better results and we get them faster that way. So
Yeah.
on retest, we know that they're doing much better.
Right. And I'm a big fan of that. I really am. I think we need more doctors doing that. because it is a system. I mean, you can't change, like for instance, you can't create a problem like even for yourself, right? I mean, with your stroke, even though your stroke happened, on the left side of your brain, even though it affected movement on the right side of your body, it just didn't affect that. It probably affected your gut function to a certain degree. I don't know if you had any like a period of like depression or cognitive challenges. So all these systems.
I didn't get depression. I got pissed off.
Okay. Phineas Gage.
I was pissed off more than I was anything else.
Okay. I could be a good thing. So I guess what I'm trying to say is that all these systems are linked together. Mm-hmm. And there are really good doctors out there like yourself who are doing the real deal, are looking at all these systems together. And they're looking at, okay, well, how does this affect the autonomic system? Okay, well, then how can I change that? If I change that, how is it affecting this? And that's where I've always been very appreciative of doctors who do that. They're far and few in between. Everyone tries to, what I've seen, everyone tries to find a technique and they just follow that technique and that's all they do.
Yeah.
As opposed to linking this all together. It's just like, just from an adjusting standpoint, the doctor who only adjusts, one area of the spine and doesn't consider, well, it's also linked to all the other areas. And maybe you might want to look at those other areas while you're doing, a holistic whole body treatment.
Yes.
Yeah.
Uh-huh.
So yeah, I commend you for doing that. That is just awesome that you're doing that. Your patients are very, how do I say this? Very lucky. Because I don't see a lot of that being done, within the profession. There are doctors doing it, but, not to the extent that you're talking about, which I think is great.
Yeah, where it gets the toughest part. The toughest part is training your staff kind of follow it, right?
Right.
I'm finally I've gotten that down. Like the staff are really kind of getting into it because they're starting to see the changes that happen.
Right.
Yeah. And one of the changes that we get, Adam, that is thrilling is when we get kids in the office that have developmental disorders and we start working with them, they grow. Like within two or 3 months, they've grown 2 or 3 inches. It's amazing. They look more mature, they act more mature, and they have a lot more confidence than they ever had. And that's kind of like the most thrilling part of it is that these kids actually
that's interesting.
Are growing up. They're growing up.
Oh, it's interesting that you say that because I just had this thought that if you have a lot of asymmetry in the functioning of, different parts of your brain, then the ability of that brain to control your posture and balance would be compromised.
Exactly.
Right. So therefore, it's easier to control the sway in a shorter person than it is in a taller person. It's like a building, right? You got a taller building is going to sway a lot more than a shorter one. So I don't know if that has anything to do with what you're noticing, but I just find it interesting that you're treating these children and all of a sudden you notice that they get their growth spurts that come in. They start growing.
They start growing again.
That's amazing. That is amazing.
So, Adam, we're going to have to stop now. Our time with this Zoom. But it was a real pleasure having you on. So we're going to
listen. Thanks for having me. And anytime you want me back and that, just let me know. And you want to just, continue the conversation. Let's do it. I love it.
All right. Super.
Okay. All right.
Thank you very much.
Thank you very much. All right. You have a great day. Bye now.
Bye-bye. Thank you for joining us on My POTS podcast. If you're looking for more support, visit us at hopebraincenter.com. or follow our journey on TikTok, where we share daily insights and inspiration. Remember, healing is possible. I'm living proof. I'm Dr. Joseph Schneider, and I'll see you next time as we continue exploring paths to recovery.